we're presenting another poster on Wednesday that is around biomarkers of prostate-specific membrane antigen targeted radionuclide therapy, or PSMA-TRT. So we know that PSMA is overexpressed on the vast majority of prostate cancer tumors, around 90%. We know that we can target those tumors either with small molecules or ligands or peptides, or with antibodies attaching or labeling them with a radionuclide, both alpha and beta emitters. And we know, based on the available information, that some patients respond very well, some don't respond, and some respond okay. So one area of our research is to look into what are the clinical or genomic or other factors that are associated with either response or resistance. We had a small data set presented at the recent 2019 GU Cancer Symposium. We looked at a small subset of patients that held exome sequencing, and looked and saw that BRCA2 was associated with both better progression-free and overall survival if patients get PSMA-targeted radionuclide therapy, which is in line with the hypothesis that they're going to respond better to a radiation-based therapy, different than the general dogmas that those patients have a worse overall prognosis. We expanded this patient population, so we have 53 patients that have any type of CLIA sequencing. So that could be germline, it could be targeted somatic sequencing, or whole exome. We lumped them together and basically saw that more or less the same thing in a larger data set, where the presence of BRCA2, either in germline or somatically, was associated with better responses in terms of PSA declines, and also associated with a longer overall survival, even when controlling for baseline prognostic factors. What we use are the CLGB or Halabi prognostic factors. So when we control for those, there's still an overall survival benefit in those tumors that have some sort of BRCA2 aberration when they receive different types of PSMA-targeted radionuclide therapy.